let's get started. I've got my first one, which I think is going to be for Keith and Amanda. I'd love your perspective on this. What makes CMT attractive to pharmaceutical companies? Or unattractive, for that matter?
Maybe I can say something first and then Keith follow up.
Sure.
So, I mean, I think actually there was a great introduction this morning in that there are so many patients that are affected by CMT, right? You don't hear about CMT maybe as much as you do like ALS, but it's actually more common. And so I think, you know, from a pharmaceutical industry perspective, it's an attractive disease to go after. I think some of the challenges are, you know, I see a lot of promise in gene therapies and genetic therapies, but as you carve it out, you know, into different subtypes, you know, some of those subtypes are actually ultra rare diseases. And so that's, you know, a challenge for drug development. And Keith, do you want to say anything else?
Yeah, I don't know if I can add anything to that, Amanda. I think that was right on.
And my next question is for Amanda, which is, are all types of CMT going to be eventually treatable through gene therapy?
Oh, well, I guess that depends on how, you know, how our research goes into identifying, you know, all of the genes for CMT, right? So we need to have a genetic target to go after. I think there still are challenges for developing gene therapies for ultra rare diseases. And so, you know, like I already mentioned, there's some innovation probably that's needed there. I think it would be wonderful if, you know, all of the types could have gene therapies. And then one additional thought too is, you know, we need to make sure for all of the different subtypes, we know the cell targets and can develop gene therapies that can get into those specific cells, whether it's the Schwann cell or the axon.
Yeah, thank you. Thank you. Professor Sung-Chul, thank you for being here in the middle of the night in Korea. I appreciate that. I know our audience does as well. You showed some really interesting videos about the mice, and I think it's encouraging. Can you tell us a little bit about what it's going to take to prepare for clinical trials in people?
Yeah, actually we have done preclinical studies, including efficacy test and toxicology test now, and we are going to submit our clinical trial application to Korea by the end of this month, and we are going to submit it by the end of this year in the United States.
Oh, that's great. So really at this point, you're figuring out the toxicology, which is how safe it might be to somebody?
It's very safe, yeah, no problem. Yeah.
That's wonderful.
That's a characteristic of cellular therapy. Yeah, cell therapy is very different that of gene therapy and the small molecules. And in most cases, cell therapy is safe. Yeah, because we are using adult stem cells. We are not using pluripotent stem cells such as embryo stem cells or induced pluripotent stem cells. Yeah, it can be form cancer tumors, but other stem cells it may not, is not possible to form cancer.
Okay, thank you. It is the top of the hour and the end of our session on cell therapies, gene therapies, and small molecules.